Hi everybody, it's Dr. Balcavage. We're back for Thyroid Thursday. Today's episode 53 and we're talking, this is part 2 of how hypothyroidism develops. So we're continuing the discussion of how somebody develops hypothyroidism from feeling great to then developing hypothyroid symptoms, then be diagnosed with a hypothyroid condition. So last time we talked about some key things. Today we're keeping on that discussion, and a couple key points for today's video is hypothyroid symptoms are the result of low thyroid hormone levels in the cell. This is a key point. It's not about what the gland makes, because we can destroy the gland, we can remove the gland, and if we give you a prescription T4 hormone or T4, T3 or T3 hormone, and that hormone gets absorbed and gets transported into the cells, and the T4 or T3 binds to the receptors, that can stimulate metabolism and you can feel great. You see that happen with people all the time. So it's not about the gland at all. It's all about how much thyroid hormone gets into the cells, converted into T3, stimulate metabolism by binding to receptors. Second point is hypothyroid conditions typically start at the cellular level. So I think this is where maybe a lot of functional medicine doctors, definitely where I would disagree with a lot of conventional medicine. In the conventional model, when you have hypothyroid symptoms, the doctor's going to look at glandular function. He's going to look at TSH, maybe T4, and if that value is normal, he's going to say you don't have a thyroid condition. And to some degree, he's right. You don't have a glandular problem at that point. But if you have all the symptoms of hypothyroidism, then you have a hypothyroid problem, but it's at a cellular level, not at the glandular level. So the gland's producing enough, there's enough in the plasma or the blood, but it's not getting transported into the cell, converted into active thyroid hormone, and binding to the receptors appropriately. And I'll be explaining why that doesn't happen in the next videos in this series. But if your hypothyroid symptoms start at the cellular level, this creates problems because you can have symptoms without gland problem. We talked about that. 2, when you see a conventional medical doctor or endocrinologist, they are testing gland function. They're looking at TSH, and TSH represents essentially how much thyroid hormone the gland is making, so that the T4 and T3 that the gland is making is enough of that getting to the pituitary gland to stimulate or saturate the pituitary gland, which would then lower TSH. So the assumption is if TSH is elevated, the gland can't make enough T4, T3, and the pituitary is being driven to make more TSH. So really what they're doing is they're looking at the gland. But if TSH is within the normal range and you have hypothyroid symptoms, so these symptoms that the doctor may have said, hey, you have all the symptoms of hypothyroidism. Matter of fact, I'm going to write down diagnosis hypothyroidism on this lab request, and we're going to run the thyroid panel. If the TSH is within normal range, now, even though you had all those symptoms that he would assume were a hypothyroid condition, he's going to say, well, the gland is fine, TSH is fine, you don't have a hypothyroid condition, because he's not aware of this cellular state of thyroid hormones. So what's going to happen? You're going to get diagnosed with something else. You're going to get diagnosed as maybe adrenal fatigue, maybe you're just depressed, maybe you're anxious, maybe you eat too much, maybe you don't exercise enough, but you're going to get diagnosed with some other condition. They're going to say you don't have a thyroid condition. And to some degree, you're right, or the doctor's right. You may not have a gland problem. The gland may make enough, but not enough thyroid hormone is being transported into the cell, converted to active T3, and stimulating the receptors. And I'm going to explain why that doesn't happen in some of these future videos. So how do you determine if there is cellular hypothyroidism, insufficient thyroid hormone getting to the receptors within the cells? 1, you can look at the T3 reverse T3 ratio. That number in a healthy state should be greater than 10. So if your ratio is less than 10, then there's probably cellular hypothyroidism going on. You can look at free T3 over reverse T3, and that ratio in a healthy state should be greater than 0.2. So if your levels are less than 0.2, then again, this cellular hypothyroidism is probably going on. You're making more reverse T3 than the active form of T3 or free T3. You could just look at reverse T3, and this is, as I've talked about in other videos, reverse T3 is an inactive form of thyroid hormone. So if reverse T3 is elevated, then and it's out of lab range and you're making way too much. That's an inactive form. So thyroid hormone isn't going to get to the nucleus and stimulate metabolism. And 4, we want to look at for signs of chronic stress response. Is this a person? Are you a person who has had chronic physical stress? Falls, accidents, injuries, trauma? Are you overtraining, excessively training, not allowing enough rest and recovery because you're not sleeping enough, you're staying up trying to do too much? If there are physical stressors, they can trigger cellular hypothyroidism. Your body's trying to shut down your metabolism. There could be chemical stressors. The foods we eat, the cigarettes, smoking, chemicals in the air, the air quality in our home, our house, the things that we eat or drink could all be things that could be toxic to the cellular system. And if those toxins, some of that chemistry gets into the cells of the body, things like heavy metals get into the cells, they will stimulate a cell danger response and induce cellular hypothyroidism. Emotional stress. So if you're bombarded and you've had a lifetime of emotional stress, that can trigger a stress response at the cellular level and induce cellular hypothyroidism. If you have stinking thinking, you're always thinking about what could go wrong, what is wrong, how you aren't happy with life, or you're just not a happy person. You may want to be on the outside, but in between the 6 inches of your ears, you're constantly have negative programming, negative thoughts going on. That will induce a chronic stress response. The chronic stress response will induce cellular hypothyroidism. And lastly, we have microbes. You could have microbial stress. Bacteria, viruses, parasites, organisms, yeast, fungus, all these things, once they get into the cells of the body, can induce a stress response at the cellular level. And in a normal, healthy immune response, if there's a stress response at the cellular level, the cells will induce cellular hypothyroidism as a normal immune response. We're going to talk about that, and the cell danger response is what it's called, in one of the upcoming videos. Okay? So this was part 2 of how hypothyroidism develops. And in this video, we really kind of talked about how hypothyroidism in most cases starts at a cellular level. TSH levels will be normal. You have to look at a more complex panel and look at T3, free T3, reverse T3, and we have to look at a person's health history. Look at their timeline of their history. What's your current lifestyle like? And if we have indicators of chronic stress and our ratios are out of range, or our reverse T3 is too high, this is a person who has cellular hypothyroidism and has symptoms that we associate with hypothyroidism even when the gland is normal. All right? Take care. Look for the next edition of how hypothyroidism develops in part 3.